I know I'm talking really fast, but I'm on my lunch break and I'm trying to see how many of these videos I can get done for you guys while I'm at lunch. So if I'm talking too fast, just keep rewinding and listening to them over and over again. So bronchitis. With bronchitis, you can have either chronic or acute bronchitis. So acute is kind of a self-limiting, isolated incident. Usually some kind of inflammation or problem with your lower respiratory tract. It's a very common reason that people seek medical care. A lot of times it's actually viral, but it can also be caused by certain triggers like dust, smoke, any kind of pollutants, chronic sinusitis. Asthmatics can experience bronchitis. So it's just a very isolated, limited kind of thing with the acute bronchitis. Symptoms: a cough that can last up to 3 weeks. They usually have clear mucus or secretions. It can be purulent, so yellow, green. Most people think, oh, I've got green snot, I've got to have an infection, but it doesn't necessarily mean an infection. A lot of times it is, but doesn't have to mean that it's an infection. These people can have a headache, they can have fever, just general malaise, just don't feel good, chest pain. So how do we for sure diagnose it? Well, based on our assessment. Then they may have normal breath sounds, they may have crackles, they may have wheezes, but with bronchitis, your treatment goal is to help them quit coughing. So how are you going to do that? Well, you're going to have them increase their fluid intake because it thins out all those secretions. So increase your fluid intake, cough suppressants. A lot of times they don't like to give cough suppressants during the day because they want you to cough that stuff up and get rid of it. But you know, at night, because it interferes with your ability to rest. So they'll give cough suppressants. If you've got some wheezing, they may do bronchodilators. They may encourage you to use a humidifier. So those are some things that you can think of for treatment for bronchitis. Again, acute bronchitis. And then avoid smoke and wash your hands frequently, so that because sometimes your viral illnesses like flu or things like that can actually precipitate a bronchitis. So it's acute bronchitis. Again, it's an isolated event. Cough can last up to about 3 weeks, and it's just a problem with your lower respiratory tract. Chronic bronchitis are the people who have a cough and sputum that lasts for at least 3 months. I hate it when I have a cough for 3 days, so I can't even imagine having a cough for 3 months. But they've got a cough for at least 3 months in 2 consecutive years. Chronic bronchitis is considered a form of COPD. In its most common, the most common cause of it is cigarette smoking, whether it is first-hand or second-hand. And some of the other causes include air pollution, fumes, dust, things like that that you're breathing in. So chronic is bronchitis that lasts, is the cough that lasts for at least 3 months in 2 consecutive years. And then acute is just a cough that lasts for about 3 weeks. So that's the difference between chronic and acute. Treatment's pretty much the same, but that's the difference between the two.